The measurement of research variables is very important in the conduct of quantitative nursing research. Without measurement, we cannot test relationships, verify results, or develop evidence based nursing practice. Let us unpack what measurement means, why it matters, what types of variables we deal with, and how reliability and validity ensure that our results are trustworthy. Measurement refers to assigning numbers to represent attributes or phenomena. Let us think about it this way. If we want to study a patient's pain level, we cannot physically see pain. But through measurement tools such as a pain scale, we can assign a number from 0 to 10 to represent it. That number now allows us to quantify a subjective experience. Measurement also ensures consistency and objectivity in data, reducing personal bias and making data interpretation possible. It serves as the foundation of quantitative nursing research because numbers allow us to compare results, identify trends, and make informed nursing decisions. Measurement is a vital part of research, especially of quantitative research. Measurement allows us to convert abstract concepts like stress, anxiety, or satisfaction, or pain into measurable variables. This conversion is essential because it turns ideas into something observable and testable. Measurement also enables comparison, analysis, and replication. For example, if two researchers measure patient satisfaction using the same validated scale, their findings can be compared and verified across settings. Another one is that measurement promotes evidence based nursing practice. Accurate data allows us to draw meaningful conclusions and apply research results to clinical area, improving quality and patient outcomes. Measurement has four components. First is the concept. This refers to an abstract idea such as anxiety, fatigue, or self esteem. Another component is the variable. This is the measurable form of the concept. For instance, anxiety can be measured through observable behaviors or scores on a standardized scale. Then we have operational definition. This allows us how the variable is measured. It gives the specific procedures or indicators used in the study. For example, saying anxiety is measured using the Hamilton Anxiety Rating Scale. The fourth one is the instrument. This is a tool used to collect data, like a questionnaire, a checklist, or a physiological device. Each of these components is essential because it translates ideas into measurable and interpretable results. In research, variables represent characteristics that can vary among individuals or groups. These are the different types. We have the independent variable. This is the presumed cause or influencing factors. Example would be the type of nursing intervention. We have the dependent variable or the observed outcome or effect, such as patient recovery time or pain reduction. There is also extraneous variable. These are other factors that may influence results, like age, environment, or medication. And we have the control variable. These variables are held constant to minimize bias. For example, ensuring that all patients receive care in the same setting. When we understand these variables, this will help us clarify that we are studying these variables, what they are, what their effect could be, and how to manage the bias. The level of measurement determines what kind of statistics we can use. There are four levels: nominal, ordinal, interval, and ratio. Each provides increasing precision and information. The nominal level of measurement categorizes data without order or rank. The purpose is mainly for identification and classification. Example, when you classify sex, could classify it into male or female. There is no hierarchy or ranking in here, just labeling, meaning male is not higher or lower than female. They are simply categories. The ordinal level of measurement involves ranking or order, but the intervals between ranks are unequal. Ordinal level reflects relative position, not magnitude. For instance, a pain scale from 1 to 5 tells us that 5 represents more pain than 4, but it doesn't tell us how much more. Other examples of ordinal level includes levels of satisfaction. One would be slightly satisfied, while 5 would be very satisfied. We have academic performance: excellent, good, fair, or poor. Ordinal data gives order, but not precise measurement of difference. At the interval level of measurement, we have equal distances between values, but no true zero point. This means the differences between numbers are meaningful, but a zero doesn't mean the absence of the attribute. Example include temperature in Celsius or Fahrenheit. Another example are IQ scores. We can compare differences but not ratios. For example, a temperature of 40 degrees Celsius is not as twice as hot as 20 degrees Celsius because zero doesn't mean no heat. The ratio level of measurement has all the characteristics of interval measurement plus a true zero point. Because of this, it allows full mathematical operations. Examples of ratio level of measurement is the height, weight, pulse rate, and income. At this level of measurement, ratio level 0 means truly an absence of it. For example, a pulse rate of 0 means zero heartbeat. This level provides the highest precision in research. Choosing the correct level of measurement is important because number one, it need to match the research purpose. It determines the appropriate statistical test and it affects data validity and interpretability. Using the wrong level can lead to incorrect conclusion. Now, what is reliability? Reliability refers to the consistency or stability of a measurement tool. A reliable tool yields similar results when used repeatedly under the same conditions. For example, if a blood pressure monitor gives different readings each time for the same patient, it is unreliable. Reliability is essential for research credibility because inconsistent data undermines trust in our findings. There are three main types of reliability. We have the test, retest reliability. This measures consistency over time. If we administer the same questionnaire twice under the same conditions, results should be similar. We have the inter-rater reliability. This checks agreement between observers. In clinical research, two nurses rating the same patient behavior should produce comparable results. Then we have the internal consistency. This examines whether items in a scale are measuring the same concept. This is often tested using convex alpha. If reliability tells us a tool is stable, let us now see how we are going to check for its accuracy. And we are talking about validity. Validity means the tool measures exactly what it intends to measure. A valid instrument ensures that our findings are truthful and meaningful. For example, a stress questionnaire should measure stress, not fatigue or workload. Validity is a core element of research integrity, ensuring that decisions based on findings are sound. What are the different types of validity? We have the phase validity. The tool appears to measure what it should at first glance. Then there is content validity, meaning the tool covers all important dimensions of the concept. For instance, a tool to measure the perception of the quality of life, the scale must include physical, emotional, and social aspects. We have the criterion validity. This compares results with an established gold standard. And then we have construct validity. These tests whether the instrument truly measures the theoretical concept behind it. Now let us compare these two important qualities side by side: reliability and validity. Reliability measures or check for consistency, and validity check for accuracy. Reliability focuses on stability, while validity focuses on truthfulness. Remember this relationship. Reliability precedes validity. A tool must first be consistent before it can be accurate. And validity ensures correctness, confirming that the tool measures the right thing. Now, what are the different measurement tools that we use in nursing research? We have the self report tools. This is the use of questionnaires and scales where respondents share their own perceptions. Another tool is the observation, using checklists to assess behaviors or skills, such as the performance of hand hygiene practices. And then we have the biophysiologic measures. These are objective readings like blood pressure, heart rate, or laboratory results, either in vivo or within the body, or in vitro or in a lab. In nursing research, using a combination of these tools enhances data accuracy and richness. There are two types of measurement errors which can occur. We have the random error. This is unpredictable fluctuation caused by temporary conditions or chance. We have systematic error, consistent bias such as miscalibrated thermometer, always reading a degree Celsius higher. Common sources of error include instrument defect, observer bias, and respondent misunderstanding. To minimize these errors, these are the things that could be done. Conduct a pretest or pilot of the instruments to detect flaws early on. Another one is to train data collectors to ensure consistency and accuracy, and also to use standardized procedure for all participants, and employ validated and culturally appropriate tools, especially in the Philippine context, where language and culture influence responses. Ethical responsibilities has to be observed in measurement. One, make sure that you have obtained informed consent before data collection. Also, maintain confidentiality of responses and avoid data manipulation or selective reporting. Ensure that you report both significant and non significant findings to maintain transparency and research integrity. To summarize, we have discussed that measurement converts concept into usable and measurable data, making abstract ideas, yes, measurable. And then proper level selection enhances accuracy in statistical analysis. Reliability and validity ensure trustworthy results, and precise measurement supports sound, evidence based nursing practice. In nursing research, accurate measurement is more than a technical step. It is a professional and ethical commitment to truth, patient welfare, and scientific integrity.